many of you and people around the world working in health, the more I learned and understood about how healthcare is designed and delivered, the more questions I had around how health systems can better serve people. Like many of you, I was moved by the stories of people with ill health. And those stories and lives for me were those of newborn babies. I found myself as a young doctor, 23 years old, in Namibia, responsible for the 2 referral neonatal units, overwhelmed by referrals of asphyxia, prematurity, low birth weight, and neonatal infections, with only 16 incubators in the public health system. So it was a turning point in my life where I learnt 2 important and significant things about the world. One was about agency, my own agency and the agency of my colleagues. Inspired and moved to do something different, we learnt and researched around the world and discovered skin-to-skin care, which was being researched in Colombia, but practiced by communities for thousands of years. Skin-to-skin care is the process of putting a newborn, typically low birth weight baby on a mother's chest in skin-to-skin contact, and the science shows it can dramatically reduce death and disease in newborn babies. This agency was also discovered not only by implementing new programs, but realizing we could change systems. We implemented new kangaroo care units, we trained hundreds of nurses, and ultimately wrote national policy within a couple of months. The other important discovery was that of social innovation. And skin-to-skin care is a fantastic example of it. It is not necessarily a highly technological, expensive, scientifically advanced innovation. There is very strong biological reasons around why it works, but it is something that has not emerged from a laboratory, but from communities. Something we have been practicing for thousands of years, and yet didn't implement into our systems that could, combined with our science, radically improve newborn healthcare. It changed my mindset, this new introduction to social innovation, around who the healthcare worker could be. In this case, the mother, and the role of the doctor and the nurse needed to change to be supportive. It also changed my mindset around what knowledge and expertise is valued. This knowledge and expertise lay in communities and in indigenous knowledge. It also changed my mindset around how healthcare is delivered. We needed to redesign hospitals, clinics, referral pathways, and policies. But also it really changed my mindset around where alternative ideas can come from. We've been looking into laboratories and science for a lot of our ideas and inventions, but less in the real world of people and communities as a source of progress and invention. So where are these ideas coming from? Paul Hawken, the renowned author and entrepreneur, in his book Blessed Unrest, described the greatest movement of our time being that of a movement without a leader, without a face, without a banner, made up of hundreds of thousands and millions of individuals, citizens, organizations, working at the grassroots primarily to create a healthy, humane society and planet. If we are really to overcome the barriers of access, inclusion, to create more patient-centered health systems and build the partnerships we need, described by the WHO, patient advocates, and those of social justice, and those we've signed up to in the Sustainable Development Goals, we will need new approaches. We will need to accelerate. We will need to become unstuck and do things differently. We have invested billions into developing drugs and devices, diagnostics and vaccines, and we need to invest as much into understanding how to deliver these into the hands of communities, but also into how communities already keep themselves healthy. One of the simplest definitions of social innovation is that of an innovation that is social both in its means and in its end. So social innovation in health is really the process in which we work with people to understand, design, develop, research, evaluate and scale solutions that are more effective, more appropriate, and more affordable. Just like TDR's work, to advance research in implementation and access, the Social Innovation in Health Initiative and its partners aims to do the same with community-based solutions. You will see on the Social Innovation in Health and the TDR on the Bertha Center website many of the case studies that we've undertaken of social innovation. And these are the best examples to inspire you. Those like Operation Asha in India, Partners in Leprosy Action in the Philippines, and the Drug Shop Integrated Management of Childhood Illness in Uganda. They demonstrate how communities, technologies, healthcare workers, and the health system can creatively improve access, quality, and the impact of health services. Returning to my journey, after working as a frontline worker in public health systems, in humanitarian settings such as earthquakes, but also in the international and multilateral institutions in Geneva and the large public-private partnerships in health, I got to understand many parts and actors and levers of the health system. But I returned again to the thing that inspired me, the stories of people making change, the stories of social innovators and their agency. And I realized that universities could create interesting platforms to advance social innovators and their work. I was fortunate in South Africa to be part of founding the Bertha Center for Social Innovation and Entrepreneurship, created by two unlikely partners, a university and its business school, and a foundation, the Bertha Foundation, supporting advancing social justice by investing in individuals in activist settings. These unlikely partners allowed us to create a diverse community of passionate thinkers and actors and a platform for innovation, research, and action. Over the last 5 years, we've developed 4 key strategies to do this. The first is the education, teaching and unlocking the agency, providing the mindsets and skill sets for social innovators in our next generation of students, but in practitioners today, wherever they find themselves in organizations and systems. Secondly, to research and identify, evaluate and build a knowledge base around what social innovations work and how they work. Thirdly, to convene unlikely partners and diverse partners, bringing them together for action. And finally, to catalyze the process of change itself. One example of this is establishing an innovation hub together with one of our leading public health hospitals to support frontline workers, nurses, doctors, but also cleaners, patients, as part of that system to generate their own ideas about how that system can work. Across the journey of the Bertha Center, we've discovered that people, no matter where they find themselves, can be part of the process of change, can be part of this largest movement of our time. And we hope that you'll be inspired by the social innovators you see to realize that you can become part of this movement. Thank you.